we present our technique for a pectoralis major tendon repair with an internal brace. A mini incision is made in lines with a normal deltopectoral incision. Soft tissue dissection is carried down to the level of the fascia, which is incised. The cephalic vein is identified and protected. The pectoralis major tendon tear is identified. In this case, the clavicular head is intact and the sternal head is torn and partially scarred down in a non-anatomic position, which is seen proximally and deep to the clavicular head. The tendon is then freed of all adhesions and debrided back to healthy tissue. A 1.3 millimeter suture tape is then placed in the middle part of the tendon in crack-out fashion for better control. A fiber tape is then placed medial to this along the medial tendon edge. Two Arthrex 1.9 millimeter fiber tacks are then placed at the superior and inferior aspect of the native tendon insertion on the lateral aspect of the bicipital groove. Each of these anchors has 4 sutures. One of these sutures is placed through the corresponding aspect of the tendon in a locking baseball stitch with 3 sutures. This is done again for the other fiber tack suture. The remaining 2 sutures are not used and are saved until the end of the case, but removed then. The suture tape that was placed in a crack-out fashion in the middle of the tendon, as well as the fiber tape, are then placed through an Arthrex 4.75 millimeter swivel lock. The swivel lock is drilled for, tapped, and then placed between the 2 fiber tack sutures on the lateral aspect of the bicipital groove. The 2 sutures from each fiber tack anchor that were placed through the tendon are then tied down to complete the tendon repair construct.